So hallux rigidus is caused by trauma to the first metatarsal phalangeal joint. Now this can be a trauma that's built up over a period of time, sometimes even years, or it can be a result of a direct injury, so something like a blow or dropping something on the toe. Now lots of patients get some degree of osteoarthritis or wearing and tearing of that joint. And also if the joint's not been functioning as efficiently as it should do, if their foot's not been functioning particularly well, then that can predispose them to problems with that joint as well. Now there are various medical conditions which can also predispose you to this, and some examples would be rheumatoid arthritis or gout. But whatever the cause, whether it's a medical condition, whether it's wear or tear, or whether it is a direct injury, essentially what happens is you get a wearing away of the cartilage, and then you get a bone-on-bone rubbing which causes an osseous build-up, and then you start to lose the range of motion in that joint, and eventually that will end up fusing together and you'll have no range of motion there at all. Okay, so when we examine this condition, the range of motion tends to be really reduced or just completely absent. And you may find when you try to manipulate the joint, it's also quite painful for the patient. Now, when we treat this condition, our main focus is to reduce the pain without causing problems elsewhere. So anything which dorsiflexes the joint will aggravate it, and so this is what we need to limit. Now we can do this very simply with an off-the-shelf device like the BioAdvanced I'm using here, and then we can put wedging underneath there to offload that joint. Or we can take it one step further and we can do a custom-made device, and we can add a stiffer material to almost shaft the first metatarsal, which will effectively brace it. Now, if we do this, we need to think about the patient's gait, so perhaps a rocker bottom shoe would also be recommended with this.